You guys are welcome to our YouTube channel, and today we'll be talking about the fetal skull and the fontanelles of the fetal skull and the fontanelles. Okay, so what are the contents of this lecture notes? First of all, we'll be talking about the regions of the fetal skull, and secondly, we'll be talking about the bones, and thirdly, we'll be talking about the sutures. Okay, those are the matured as forms of fontanelles. And then lastly, we'll be talking about the fontanelles. Okay. All right. So without wasting time, let us continue on our video. All right. So the introduction to the fetal skull. We see that at birth, the calvaria is large in proportion to the other skeletal parts, reflecting a cerebral maturation, and the facial region is relatively small and constitutes only about 1/8 of the neonatal skull, whereas it constitutes about half of the adult skull. Okay, still talking about the introduction. This is just a comparison between the adult skull and the fetal skull. You could see that the fetal skull we have the fontanelles, all right, and why in the adult skull this is fused to give you bregma. This is the anterior fontanelles, all right, and the sagittal suture is somehow open too. You could see that in the adult the sagittal suture is fused all together. All right, so without wasting time, let us proceed. And this is also a difference between the adult skull and the or sorry, this is the adult skull and this is the fetal skull. Still talking about the differences between these two skulls. Alright, so now let us talk properly on the fetal skull. Alright, so Tessa, the skull bones encase and protect the brain, and the major parts of the skull bones include the face, the base, and the vault. You could see the face here, you could see the base here, and you could see the vault here. And these are the major parts of the skull. Okay, so let us proceed. Alright, so talking about the vault, we'll be talking about the bones of the vault. Okay, the bones of the vault includes two frontal and two parietal. These are the frontal, and you could say that around the middle side, the frontal is separated by the frontal suture, abi, which later becomes the mectopic suture. And this is the parietal bones. At the other side, you see the parietal bone too, and we have one occipital bone. This is the occipital bone at the back of the head, and we have two temporal bones. Okay, from here you could see the sphenoidal fontanelle, but we'll speak extensively on the fontanelles later on in this lecture. Okay, you see the anterior fontanelle, you see the frontal bone, and right, you see the divisions of the frontal bone, and you could see two frontal bone here. You could see two parietal bones here, and you could see one occipital bone here. And next, you see the posterior fontanelle here. All right. So let's continue. I'm talking about the vault. We see that it is a large dome-shaped part above an imaginary line drawn between the orbital ridges and the nape of the neck. Okay, and how about the base? The base comprises bones that firmly unite to protect the vital centers in the medulla oblongata. The base comprises of bones that firmly unite to protect the vital centers in the medulla oblongata. So how about the face? And the face comprises of 14 bones that are firmly united and are non-compressible. The bones of the face are 14 in number and are non-compressible. Okay, so let's talk about the frontal bones, the two frontal bones. They form the forehead or the sinciput. Okay, and these are the two frontal bones that we are talking about. The two frontal bones All right, you could see the anterior fontanelle, you could see the mectopic suture. The mectopic suture separates the two frontal bones. Okay. All right, so see that the ossification center of each bone is frontal eminence. Okay, and they fuse into single bone by 8 years. This is just to tell you that in the fetal stage, these two bones are separated by the mectopic suture, and in the adult stage, approximately in when the child is 8 years, and the two of them fuse together. Okay, so let's not waste time. Let's be going. Now we'll be talking about the two parietal bones. The two parietal bones lie on opposite sides, and in between them we have the sagittal sutures. All right, they lie on either side and occupy most of the skull. They are the largest bones of the skull. And the parietal eminence, that's the ossification center of the parietal bones. Okay, you see the anterior fontanelle here, you see the mectopic suture, you see the frontal bone, you see the coronal suture, you see the posterior fontanelle, you see the occipital bone, you see the sagittal suture. Okay, moving ahead, we'll be talking about the occipital bone. All right, the occipital bone is this bone at the back. Okay, this is the bone at the back, and this picture you see here is like uh the skull turned upside down. Okay, you could pause this video to see the various parts of the skull here. You see the mastoid fontanelle, you see the foramen magnum, you see the occipital bone, that's the squamous part, you see the parietal bone, you see the posterior fontanelle and everything. Okay, so moving forward, I will be talking about the temporal bone. Sorry, we will be seeing the temporal bone. So this is the temporal bone. To be specific, we say that that's the squamous part of the temporal bone. This is the occipital bone, this is the parietal bone, this is frontal bone, and this is the sphenoid bone, specifically at the greater wing of the sphenoid bone. And this is the zygomatic bone, here but not labeled. This is the zygomatic arch. And you see the infratemporal fossa below the zygomatic arch. This is the temporal fossa above the zygomatic arch. Okay, you see the tympanic ring, you see the lambdoid suture and everything. You see the mastoid fontanelle. Okay, so now let's talk about the fontanelles properly. We say that the fontanelles are the fibrous membranes that form the calvaria remains. Okay, and they remain ossified at the 6 angles of the parietal bones, producing the 6 fontanelles. Okay, the two single midline, that's the anterior and the posterior fontanelles, and the two lateral pairs, that's the sphenoidal stroke anterolateral. You could call it the sphenoidal or the anterolateral, and the mastoid or the posterolateral. Okay, these are the fontanelles that we have. Now this is a picture showing the fontanelles properly. You could see the anterior fontanelle here, you could see the frontal bone, you could see the sphenoid fontanelle, you could see the mastoid fontanelle, you could see the anterior fontanelle, posterior fontanelle here, you could see the sagittal suture, you could see the parietal bone. Just beautiful images for you to be able to comprehend what we have been talking about. Okay, bones of the neonatal skull. Okay, without wasting time, let's move on. Okay, so now let us be talking about the anterior fontanelle. All right, and you could see this baby. This is the anterior fontanelle that we are talking about. And these are the bony plates. Those are the two frontal bones in the neonates. And we learned that in adults they fuse to become one bone. And so let's talk about the anterior fontanelle. We say that it is the largest and is rhomboid in shape. It is 4 cm antero-posteriorly. It is 2.5 transverse. Okay, it is formed between the sagittal, transverse and frontal suture, and it closes at 1 year or 18 months. That's 1 year 6 months. Okay, 1.5 year. All right, that's the anterior fontanelle. So What is the clinical correlation of the fontanelle? We say that palpation of the fontanelle is used clinically. All right. A sunken fontanelle indicates dehydration. Tense or bulging anterior fontanelle indicates raised intracranial pressure. That's meningitis, hydrocephalus. Okay. When there is raised intracranial pressure or right. Raised intracranial pressure is caused by meningitis or hydrocephalus. So when there's a situation of this raised intracranial pressure, you could see that the anterior fontanelle will bulge or tend. Okay. So now let's talk about the posterior fontanelle. We say that the posterior fontanelle is triangular and is in between the sagittal and the lambdoid suture. Okay. The posterior fontanelle, you see it here, is in between. This is the lambdoid suture, and next this is the this is the lambdoid suture. This is the sagittal suture, and you have the posterior fontanelle here. It closes at just 6 to 8 weeks, not even up to a year. The posterior fontanelle will first of all close. Okay, delayed closure suggests hyperthyroidism. Okay, you see the frontal bones, you see the anterior fontanelle, you see the posterior fontanelle, you see the occipital bone, you see the lambdoid suture, you see the parietal bones, you see the coronal suture, you see the mectopic suture. Okay, now let's talk about the anterolateral fontanelle or the sphenoidal fontanelle. You can see the anterolateral fontanelle is just by the side here. No, sorry, this is it. The one at the back here is the posterolateral fontanelle or the mastoid fontanelle, something like that. It lies at the sphenoidal angle of the parietal bone and between the sphenoid, parietal, temporal, and frontal bones. It fuses at 6 months. Okay, I'd like you to note the various times in which these fontanelles fuse. Okay, these are good MCQ questions. So the anterior fontanelle, we said that it fused between 12 months to 18 months, and the posterior fontanelle, we say it fused between 6 to 8 weeks, and the anterolateral fontanelle fused between 6 months. Okay, let's proceed. Talking about the posterolateral fontanelle, we say that it is also called the mastoid fontanelle. All right. Bilateral soft membrane gaps at the junction of the parietomastoid and occipitomastoid and lambdoid suture. This is the posterolateral fontanelle that we are talking about. All right. It is also called the mastoid fontanelle. Okay. This is a posterolateral fontanelle. All right. It fuses at 6 to 18 months, and it becomes the asterion in adults. Okay. Um, the posterolateral fontanelle becomes the asterion in adults. Right? I hope you are following. Now, let's just briefly talk about the sutures. Okay. The sutures, you see the frontal suture, you see the parietal suture. No, sorry, you see the parietal bone, you see the sagittal suture, you see the occipital suture, occipital bone, you see the lambdoid suture, and just a good picture trying to show you and what the fontanelles become in the adults. So let's talk about the mectopic suture. It is also known as the median frontal suture, an vertical fibrous suture that divides the two halves of the frontal bone. It runs across the frontal bone from the nasion to the bregma. It fuses at 3 to 9 months. Okay, now let's talk about some clinical correlations to the fontanelles. And the first one is mectopic synostosis. This is premature fusion of the mectopic suture. It results in trigonocephaly. This is a normal fusion, and this is a mectopic cranial synostosis, trigonocephaly. You could see a child with this shape, right? You could see a child with it, and you could see that the forehead is protruding. Okay, you see the forehead protruding. All right. So, guys, with this, I've come to the end of our lecture on the fontanelles in, or we say, the anatomy of the fetal skull and the fontanelles. Okay. So, see you guys in the next tutorial, guys.